This screencast will deal with general anatomical terminology. Now, in the human body, the first thing you want to note is that humans have bilateral symmetry. That's where one half of the body mirrors the other half. If you look at this picture on the right here, you can see that if you were to draw a line through the midline of the body here, that the left half would superficially be similar to the right half. And that's what we mean with bilateral symmetry. Now, does it hold true throughout the body? No. In fact, externally, you're going to have slight variations in the human body from right to the left side. And internally, there's going to be a lot of, especially when you get down to the abdominal pelvic cavity or the thoracic cavities, you're going to have less than perfectly symmetrical mirroring images of the body. Now, one thing we should note here is standard anatomic position. The standard anatomical position is as this specimen on the right is standing. He's standing there with his arms hanging down, his feet about shoulder width apart, and his palms facing forward. Remember this because when we refer to most anything that we refer to in this course, we're using the standard anatomical position as our point of reference. And whether we're talking about something dealing with muscle structure or internal organs, it could be applied to any unit that we use in anatomy and physiology. So standard anatomical position is just like this specimen here on the right is exhibiting. Now let's look at some directional terms. The first two refer to how they're positioned on the body. Ipsilateral means it's on the same side as a comparable structure, and contralateral would be on different sides. Now, these terms aren't used very often, so we're not going to become overly concerned with them. That's why they're not highlighted. So we'll move on to the next one, which is used quite often, superior and inferior. Superior is the upper or the top. Inferior refers to the lower or the bottom. Since a human is an upright individual, a standard anatomical position here, superior would be toward the top of the head. Inferior would be toward the bottom of the feet. That can apply to the human body. It can apply to individual organs. For example, you can talk about the, inferior side of any organ in the body versus the superior, and we would know that if that organism, that person was standing, we would know about where they're talking about on that organ. But it's also can be used just in general anatomical terminology with human body. For example, if you're having an examination and you need to say, okay, I need to note that there's a growth on the superior side of the liver or whatever, you would know that would be the upper side of the liver and not the lower side. Now, let's take a look at anterior and ventral. In a human, because you're on two legs, those are actually going to be the same, refer to the same side or positioning of the body. Anterior and ventral in a human both mean toward the front. Anterior is toward the front by definition. Ventral is actually toward the belly. But in a standard anatomical position, the belly is in the front. So, and that's going to be different than if you had a fish or a cow or something like that are oriented lengthwise. The belly would be on the lower side and the anterior would be toward the head. But on a human, it's not that way. Now, posterior is back and dorsal are toward the rear, and dorsal actually refers to the back. So on those two, they're also the same as a human. So anterior and ventral are the front or belly, and posterior and dorsal are the rear or the back. The next few terms are going to be kind of comparative terms. For example, medial and lateral refer toward the midline or away from the midline. Medial is towards the midline, and lateral would be away from the midline. For example, if you had you were a dermatologist or something, and you were describing a mole that this individual had on his cheek over here on the left side, you would say, well, that's maybe medially lateral or medially located from the ear 6 centimeters. And then you would, give you a point of reference where to look. Or it could be laterally located on the nose 2 centimeters. And you would know that that would be 2 centimeters away from the midline there of the nose. So, and one thing here we should note, right and left in standard anatomical position, it's not your right or left when you're viewing, but it's the right or left of the subject, the patient. And that would make this the right side of the patient and this the left side. And as you're viewing it, that's not what you're seeing, but put yourself in the patient's position. And unfortunately, every year you'll read about somewhere where maybe there was a surgery done on the wrong leg, or there was even something, as serious as an amputation or something where they took out the wrong thing because just a lapse in thinking there. But it's the patient's right. So, and if you think about this patient, this is his right arm, left arm, even though when you're viewing it, it's flipped from that. So remember, our right and left always comes from the patient's point of view. Now, proximal and distal refer to appendages. Whether a structure is nearer to the body's, the connection point with the body for that appendage, that's proximal, or farther away from the connecting point to the trunk or body, and that would be distal. So if you're talking about a structure here, we'll use the knee as a point of reference, which is located distally from the knee. Well, the foot would be distally from the knee. The tibia and fibula would be located distally. The femur here would be proximal of the knee. And then the patella is what we correctly call the knee. But that's what we're talking about. If it's closer to the trunk from whatever point of reference you have, that's proximal. If it's away from the trunk, it's distal. The last two, superficial and deep, those are more descriptive. You see that sometimes when you're talking about like a description of a wound or a injury of some type. If it's superficial, that means it's probably near the surface, and if it's deeper, that's usually more where it's been caused an internal problem. A puncture would be a deeper wound. A scrape would be a superficial wound. Let's next take a look at body planes and sections. Now, there's generally 3 types. I put the alternative names with a couple of them as well, but if you know what's highlighted, you'll be good for these. Sagittal is going to be a plane that runs lengthwise from front to back. And what you want to remember with sagittal makes a division that would divide the body into a right and a left. If it's down the complete midline of the body here, that's a mid-sagittal, if it runs right down the mid-center of the body. And that'll make your, think of your bilateral symmetry, that would make this left side here and this right side over here. So mid-sagittal is down the body's midline. If it's offset slightly, that's parasagittal. Now, you can also refer to, for example, if you had, when we look at a sheep's brain or something, and you're going to make a sagittal incision, you would divide that brain into the right and left sides. So sagittal runs lengthwise and makes a right and a left. Frontal, also called coronal, but like I said, we want to use frontal. Frontal runs lengthwise, and it runs from side to side, and it makes a front and a back. So a frontal division or a frontal plane would create a division that would make, the anterior divided from the posterior. And, once again, we can use these on individual organs. For example, when we look at the heart, we're going to use a more of a frontal plane incision so we can see all 4 chambers of the heart. Now, transverse is by far the easiest. It's also called the horizontal plane. Transverse divides the body into an upper-lower or an organ into an upper and a lower. And a transverse plane is also known as a horizontal plane for obvious reasons. So transverse makes an upper or lower, frontal makes a front and a back, and sagittal makes a right and a left. Review this real quick. Just remember standard anatomical position, feet shoulder width apart, arms hanging to the side with the palms facing forward. Superior is basically up, inferior is down, anterior and ventral are front, posterior and dorsal are back. Medial and lateral are points of reference using the midline of the body, with medial being closer to the midline and lateral being farther away from the midline. Proximal and distal are points of reference used with an appendage, with proximal being closer to the point of attachment to the body and distal being farther from the point of attachment with the body. Superficial and deep are descriptive terms about surface of the superficial versus internal with deep. And the planes, sagittal makes a right and a left, frontal makes a front and a back, and transverse or horizontal makes an upper and a lower. This will conclude this video over general anatomy terminology.